Hi, my name is Miguel Gomez with HIV.gov. I'm in Houston, Texas, on the eve of the 80th PACHA meeting. But right now I'm going to talk about another event, a research conference that happened earlier this month called CROI. And I'm here with two PACHA members who are fortunate enough to attend the conference. I'm going to ask them for their reflections on the conference. First, Jeff Taylor. Jeff, could you please introduce yourself and share some of the highlights from CROI from your lens?
Sure. My name is Jeff Taylor. I'm with the HIV and Aging Research Project in Palm Springs. And I've been to CROI many times. I was on the planning committee for a number of years on the community liaison subcommittee. And something they've done for the first time this year, which was really kind of exciting, for me, having been there on the planning committee and selecting advocates from all over the world to attend, was a mentorship program that they've done for the first time. And it was really exciting to be able to have a formal mentorship program and programming specifically for the advocates who had come from all over the world, most of them for the first time. So they'd never been, many of them to the US, let alone to a huge scientific meeting. So as you can imagine, they're kind of caught in the, like deer caught in the headlights. And it was really gratifying to have a number of things specifically for them, not just mentors like myself and other seasoned advocates. The other three were all from sub-Saharan Africa. But each morning they had breakfast updates. And these happened each morning before the conference at 7 o'clock. When my day, we started them, they were in person and actually served breakfast. During COVID, of course, they had to go virtual, and they've kept them that way. And the advantage is that it's really been a great way for the broader community to find out what's going on in CROI firsthand from the people there.
No, actually, absolutely. Just like we're doing right now, the information coming out of CROI is critical to all of us doing HIV-related work. And for some of our viewers, they may not know the amazing legacy and work you've been doing in the aging side of the street when it comes to the HIV response. What I'd love you to do now is share some of your perspective on what you heard from CROI.
Sure. Well, aging is really kind of coming into its own right now. For many years, it was really kind of the redheaded stepchild of research. But I think people are finally coming to realize that, we're here to stay. We're all getting older. And the upside is that people aren't acquiring HIV as much as they used to. So the whole population is going to age. And there's some really fascinating research that came out. A lot of abstracts and presentations from the Reprieve study, which, as you may know, was the study looking at pitavastatin in people 40 and above living with HIV. And what they found, fortunately, it was a huge study, almost 8,000 people, a huge investment on the part of ACTG and the Division of AIDS, was that giving people a statin, even if they wasn't clinically indicated by current standards, did improve outcomes. It lowered death rates and cardiovascular events. And there's some signals that the inflammation lowering effects of the statin may have other benefits as well, and they're continuing to study that. But it's already changed clinical guidelines. So that was really exciting, I think, to see that information come out and see the guidelines starting to change as a result.
Which is one of the amazing impacts of CROI, sometimes short-term, sometimes long-term. Now, I'm also here with a PACHA member, Patrick Sullivan, and you presented on findings related to PrEP and new diagnosis. One of the things I thought was so important is the CROI organizers thought what you were presenting was so critical that they actually invited you to also present at the press conference. Could you please share with those watching, when you were at CROI and you were presenting the study, first, what was the study and what did you share, especially during the press conference?
Sure, thanks. We had the chance to talk about some work that asked the question, more than a decade into PrEP, do we have evidence that it's really working to reduce infections at the population level? So I worked with a great group of colleagues, and we analyzed data from 2012 to 2021 across the whole United States, and asked the question, if you break states up into groups like the 10 states that did best with respect to meeting their needs for pre-exposure prophylaxis and put them into 5 categories, did those categories have different outcomes with respect to new diagnoses? And what we found was, one, there's a lot of variation between states that are doing well with PrEP coverage and ones that still have a lot of opportunity to improve PrEP coverage, a 3-fold difference in the level of PrEP. But the 10 states that were doing the best with meeting PrEP needs, in other words, getting it to people who have an indication for it, those states had an average 8% decrease in new HIV diagnoses year after year after year. And in contrast, the 10 states that had the lowest level of coverage actually had small increases in diagnoses every year. So I think the main message was that when we get PrEP to scale, and we're talking about getting about a third of the way there nationally, maybe 36% of people who might benefit from PrEP are taking it. And even just getting to that first third, we can see that it's having an impact at the population level. And what was really exciting, I think, about being at the conference is that that this is what we had researched and found, but there was a whole series of posters and of presentations that talked about all the stages of the PrEP cascade, PrEP awareness, a great data that showed that policy matters and that expand Medicaid or add a PrEP drug assistance program. After those programs are put in place, PrEP use goes up in those states. So I feel like there's a lot of evidence about the tools and the policies that can get us to that high level of PrEP coverage. And then the work that we were able to present showed that if you get to that high level of PrEP coverage, it translates to reductions in new HIV diagnoses.
And when you shared that information, I must admit, you could hear a pin drop in the press room. It is really important because we know PrEP works, but we know it's now having an impact thanks to your work and the work of others. Now, Patrick, I have another question for you. You started talking about other things that were happening at CROI. Sir, is there any other takeaways that you would like our listeners to know from your lens that were important outcomes?
Yeah, I think this idea that we now have the tools that we need to end the epidemic. That's true on the side for people living with HIV, that people living with HIV who get appropriate medications live long, healthy lives, are incapable of transmitting HIV. And on the prevention side, people who may be at elevated risk now have a tool that sort of works at the population level. And all along, what we talk about is a prevention cascade, which is on the prevention side, people need to be aware of PrEP. They need to have access to PrEP. They need to decide to take PrEP. They need to adhere to PrEP. And if we follow all those steps, then there's a lot of opportunity for prevention. And at CROI, we had along each of those steps data, digging in about who knows about PrEP and who doesn't. Monica Gandhi presented data in Kenyan women that showed if you do a point of care test that shows people that when you take your medications, it shows up on this test strip. Think about our COVID test that we learned how to do, and they can see that they have that protection in their blood. That's associated with better adherence. When states adopt better policy, that's associated with broader PrEP use. And when we get to that broader PrEP use, we see diagnoses coming down. So the conference just really addressed from the beginning to the end of this story and shows that we really have all the tools we need for people living with HIV and for people who may be at risk for HIV to end the epidemic.
Well, Patrick, thank you. Now, Jeff, we've been talking for a bit. Before we end, are there some other thoughts that you would like to share with those watching this video that were important to you that came out of CROI?
Well, I think they have a young investigator session. That's the day of the conference before the main plenary, and for the first time, they invited someone who's been cured of HIV to speak at that. Adam Castillejo, the so-called London patient. So I think that was really important for people to see, especially the young investigators, to kind of understand the history of what people have been through and what it means to be cured of HIV, and that there are really people out there. A lot of people are doing this research, preclinical research, never meet somebody living with HIV. So it was really important to have that at the conference along with the advocates as well. So that was really inspiring to see.
No, I agree with you, and all the information presented related to cure, which what I really liked about CROI is it put it into perspective, not just the headlines of an individual, HIV eradicated an individual, but the wonderful news that was presented that we have a road ahead, but we are moving forward on that road. We just have to really engage with advocates, researchers, academics, the community, and use data to make decisions that are solid for communities. Gentlemen, I know PACHA is about to start. You have a lot to do, but I really want to thank you for pausing to talk to us because the CROI conference, it produces a lot of key research, and you can watch hiv.gov for many other videos on CROI, but I want to thank our PACHA colleagues for joining and sharing more with you. For more information on CROI, visit hiv.gov. Thank you for your time.